If that were true, the safest strategy would be to move less. But human joints are not machines. They're living tissues that respond and adapt to the loads placed on them. And when researchers began studying knee osteoarthritis more closely, the relationship between movement and joint health turned out to be very different from what many people expected. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle. Today we're continuing our series called Knee Replacement Myths That Cost People Time and Money. In this series, we're looking at some of the most common things people hear when they're trying to decide how to manage knee arthritis or whether knee replacement may eventually become the right step. One belief that shows up again and again sounds very reasonable on the surface. If your knee joint is already wearing down, shouldn't you avoid exercise to protect it? By the end of this episode, you'll understand where that idea that exercise harms the knee joint came from, what research actually shows about movement and arthritis, and why strengthening and activity are often one of the most effective ways to support knee health. Many people with knee arthritis receive mixed messages about activity. On one hand, they're encouraged to stay active. On the other hand, they're warned not to overuse the joint. Over time, those messages can blend together into a simple but powerful assumption. Movement must be wearing the joint out, or so many people assume. I hear this concern quite often when people first start talking about exercise with knee arthritis. Someone will say something like, "I've actually been trying to move less so I don't wear the knee out any faster." It's an understandable thought. If a joint is already wearing down, it can feel logical to protect it by using it less. But what many people eventually discover is that when activity decreases, strength around the knee often decreases as well. And that loss of strength can actually make everyday movements place more stress on the joint, which can make activities like walking, stairs, or standing up feel more uncomfortable. This idea is closely tied to how many people first hear osteoarthritis described. Osteoarthritis has been described as a wear and tear condition. When people hear that description, it can sound as if the knee works like a mechanical hinge that gradually grinds down with use. If that were true, the safest strategy would be to move less. But human joints are not machines. They're living tissues that respond and adapt to the loads placed on them. And when researchers began studying knee osteoarthritis more closely, the relationship between movement and joint health turned out to be very different from what many people expected. To understand how this myth developed, it helps to briefly look at where the idea of exercise damaging cartilage first appeared. Several early laboratory studies in the 1970s examined how cartilage responded to very high mechanical loads. These studies often used animal models and applied repetitive impacts or loading conditions far beyond what occurs during everyday human movement. Under those extreme circumstances, cartilage degeneration could occur. Those findings were important for understanding how joint tissues respond to stress, but the results were sometimes interpreted in ways that extended far beyond the conditions that were actually studied. Over time, a simple narrative developed. If loading can damage cartilage in extreme laboratory conditions, then exercise might damage cartilage in people with arthritis. That conclusion seemed cautious and protective. So for many years, some patients were advised to avoid activity in order to prevent further joint degeneration. More recent research has helped clarify that picture. Exercise therapy does not appear to worsen joint structure in people with knee osteoarthritis, and appropriately prescribed exercise programs are consistently associated with improvements in pain, strength, and physical function. I can attest to this. I've seen this happen. In other words, the joint often responds positively when it's loaded in controlled and progressive ways. Part of the reason exercise helps is related to the muscles that support the knee. The quadriceps muscle group on the front of the thigh plays a particularly important role in knee stability and shock absorption during walking, stair climbing, and standing up from a chair. When knee pain leads people to reduce activity, quadriceps strength often declines. As the muscle group becomes weaker, the knee may experience greater mechanical stress during daily movements, which can contribute to more discomfort and less confidence during activity. Strengthening exercises help reverse that cycle. When the quadriceps and surrounding muscles become stronger, they assist the joint in absorbing load and stabilizing movement. Many people notice that activities such as walking, rising from a chair, or climbing stairs begin to feel more manageable as strength improves. And those are just some examples of movements that I've been using. They're obviously not the only movements that we do. Exercise also affects the joint environment itself. Movement helps circulate synovial fluid within the knee joint. This fluid provides lubrication and nourishment to the cartilage surfaces. As the knee bends and straightens, the joint gently compresses and releases, helping spread that fluid across the cartilage. Gentle loading and unloading of the joint during movement helps distribute that fluid, which supports cartilage health. Activity also has important effects on the nervous system. Pain in osteoarthritis does not come solely from structural changes inside the joint. Pain perception is influenced by many factors, including inflammation, sensitivity in surrounding tissues, and how the nervous system processes signals from the joint. Regular movement and strengthening exercises can help modulate those pain signals over time, which is one reason many rehabilitation programs emphasize gradual increases in activity. One of the most interesting shifts in osteoarthritis research over the past decade has been the recognition that inactivity can create its own set of challenges. When people begin avoiding movement because of knee discomfort, several things often happen at the same time. Muscle strength declines. Joint motion becomes more limited. Balance and coordination can change. And overall activity levels decrease, which affects cardiovascular health, energy levels, and overall mobility. Over months or years, that pattern can make everyday activities feel more difficult, even if the structural changes inside the joint have not dramatically progressed. That's why many modern treatment guidelines emphasize exercise as a central component of osteoarthritis management. Exercise programs are typically designed to include a combination of strengthening, flexibility, and aerobic activity. The goal is not to push the joint into painful overload, but to gradually build the capacity of the surrounding tissues so the knee can tolerate daily movement more comfortably. Before we continue, I want to mention something that may help if knee replacement is on your horizon. I created a free guide called the Total Knee Success 14-Day Launch Plan, and it's free to download. It provides a clear checklist for the final 2 weeks before surgery, so you know what to prepare, what to expect, and how to set yourself up for a smoother first week after surgery. If you'd like a copy, you can download it through the link in the show notes. And if you're getting ready for knee replacement and want to know how prepared you really are, check out the knee replacement game plan. Inside the book, you'll find the Total Knee Success Readiness Score. It walks you through key factors that can influence your recovery, things like strength, range of motion, daily function, and lifestyle habits, so you can see where you're starting and what to focus on before surgery. To learn more or to get your copy, visit totalkneesuccess.com or check the show notes. Let's return to the question many people ask when they first begin exercising with knee arthritis. How do you know if you're doing the right amount? One helpful way to think about this is to treat activity as something the joint can gradually build tolerance to, much like any other part of the body that adapts to training. A practical guideline many clinicians use is sometimes called the 24-hour response rule. Mild to moderate discomfort during exercise is often acceptable, especially when starting a new strengthening program. Muscles that have not been challenged in a while may feel tired or mildly sore afterward. We're not talking about severe joint pain. We're talking about muscle soreness. More important signal is how the knee responds over the next day. If symptoms settle back to your usual baseline within about 24 hours and swelling does not significantly increase, the activity level was likely appropriate for your joint. If pain remains noticeably elevated the following day, or the knee becomes more swollen or stiff, that is often a signal to reduce the intensity, duration, or resistance the next time. Another helpful approach is to increase activity gradually rather than making large jumps. For example, adding a few minutes to a walking program or adding a small amount of resistance to strengthening exercises allows the joint and surrounding tissues time to adapt. These small adjustments help people stay active while also listening to their body's feedback. This type of gradual progression allows the joint and surrounding tissues to adapt over time. For many people, the goal is not only reducing pain, but also improving confidence in movement. Activities like walking longer distances, climbing stairs, or getting up from lower chairs can begin to feel more predictable when strength and mobility improve. It's also important to remember that exercise does not need to look like a high-intensity workout to be effective. Guided physical therapy programs, strengthening exercises, stationary cycling, walking programs, and aquatic exercise can all contribute to improved function for people with knee arthritis. The key idea is that movement is often a part of the solution rather than the problem. Understanding this can shift how people approach their knee health. Instead of thinking about the joint as something fragile that must be protected through inactivity, it can be helpful to think about the knee as a system that becomes more resilient when the muscles and tissues around it are trained appropriately. That perspective can also influence how people prepare for knee replacement, if surgery eventually becomes the right step. Strength and mobility before surgery often influence how people move during the early weeks of recovery. Patients who maintain activity and participate in strengthening programs before surgery often begin rehabilitation from a stronger starting point, which can support a smoother early recovery process. This is sometimes referred to as prehabilitation, and research has shown that targeted exercise programs before surgery can improve knee function in the months surrounding total knee replacement. All of this brings us back to the myth we started with. Does exercise wear out your knee joint? Current research suggests the opposite. Appropriate exercise does not appear to worsen joint health in people with knee osteoarthritis, and it remains one of the most consistently recommended strategies for improving pain, strength, and daily function. Movement, when guided appropriately, can help the knee work better. In the next episode, we'll explore another expectation that many people hear when they begin planning for knee replacement. Some patients are told they'll be back to normal in about 6 weeks. But recovery after knee replacement involves several phases of healing and adaptation, and understanding that timeline can make the experience much less stressful. And remember, with knee arthritis, the goal isn't avoiding exercise. The goal is finding the amount of movement your knee can tolerate and gradually building from there. Thanks for joining me today. I'm Michelle, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.